All right. Good morning, and thank you all for joining us once again for another installment of the Los Angeles County Economic Development Corporation's COVID-19 Economic Implications webinar series. Once again, we are joined today by the LAEDC CEO, Bill Allen, and the Director of the Institute for Applied Economics, Shannon Sedgwick, who will provide insight into the impact the COVID-19 pandemic has had on the region's economy. Now, I'd like to introduce the CEO of the Los Angeles County Economic Development Corporation, Bill Allen.
Thank you, Shane, and welcome everybody. It's wonderful to have you all join us again for the latest in our series of regular Monday morning updates on the economic implications of the COVID-19 pandemic. This morning, I must begin by reminding you that for the past 3 months, we have been using these webinars to share with you how extraordinarily serious and ubiquitous the impacts have been on our economy and our residents across Los Angeles County, how they have particularly disproportionately impacted our low-income communities of color all across Los Angeles County, and how ill-prepared those lower-income communities are for such economic shocks, given the relatively modest net worth of these families. They just have not had the personal savings to withstand such an economic shock. We're going to be giving you updates today on the continuing pattern of significant numbers of filings for initial unemployment insurance claims in California, even during this reopening phase. We're also going to give you some updates from the latest U.S. Census Bureau Household Pulse Survey, which capture the painful impacts of this pandemic on individuals and families here in our region. We'll also give you an update on current conditions of key industries that have been most impacted by the shutdown orders. But before I turn things over to the director of our Institute for Applied Economics at the LAEDC, Shannon Sedgwick, I must tell you how distressing it is to me personally to see the positivity rate in testing for COVID-19 rising so significantly over the last 2 weeks here in Los Angeles County. We have tested more than 1,037,000 individuals here in LA County during this past 3 months. We keep track of a cumulative 7-day average of the testing, of the positivity rates in that testing, and it has hovered between 8 and 9%. But as we began to move towards the reopening phase, we were fortunately seeing that 7-day average of positivity rates declining pretty significantly into the mid-5s. Just a couple of weeks ago, it was 5.8%, indicating that community spread was relatively under control. And so we had confidence to begin opening sector after sector of our economy. Unfortunately, the most recent 7-day average of positivity rates has climbed to 8.8%, about a 50% increase in just 2 weeks. That is indicative of significant community spread. Whether it's from Memorial Day festivities, as some have speculated, people participating in protest marches, as others have speculated, people just getting out and visiting with friends without taking the appropriate protections, letting down their guard somewhat, or people getting out to bars and restaurants, again, without either the facility or the patron taking the appropriate precautions. No one knows for sure, but it's likely a combination of those factors and more. What we do know is that when public health inspectors went out to visit 3,700 bars and restaurants during the reopening phase, they found that fully 83% of them were not in compliance with the basic public health and safety orders required to keep their workers and their patrons safe. As a result, Governor Newsom and our public health departments have just had to order our bars closed again, effective immediately. Currently, we have 1,698 people hospitalized here in Los Angeles County. That is up from just 1,350 a couple of weeks ago. This is, again, a very serious increase. We must all demonstrate personal responsibility and leadership. My colleagues and I call upon all of you who we believe are our partners in economic development in this region, who are ambassadors of a just and inclusive and sustainable and growing economy for the benefit of this region's residents. We call upon you to be leaders in your families, in your neighborhoods, in your broader communities, in your workplaces, in the stores and restaurants and other places you patronize, to ask people to act responsibly. Wear the mask. Keep your distance. Do the simple things that we are being called upon as a nation to do to help this economy recover. The data you'll hear from Shannon today is just the latest in a series of data we've been giving you that reminds you how painful this pandemic has been to individuals, families, small businesses, our economy, and our nation in general. If we're going to continue on this path to reopening, if we're going to give businesses a chance to reinvent themselves, to survive in these limited capacities they need to until we have a vaccine to substantially reduce the threat of this virus, we're going to have to do better than we've done in the last couple of weeks. So I implore all of you, as the CEO of your economic development organization, to be full partners with us in this safer at work ethic that Supervisor Catherine Barger has been talking about. We all spent a few months being safer at home and focused on rules to be safer at home together. There are now rules that will allow us to be safer at work together. Let's know them, let's share them with everybody in our sphere of influence, and let's model the right behaviors so that we can work our way out of the economic hole that we are in before too many lives are permanently damaged or lost to the virus. With all that said, we do have a lot of new data, as I mentioned, that I want Shannon to share with you, and then hopefully we'll have a few moments for questions. So let me turn the program over, as always, to the director of our Institute for Applied Economics, Shannon Sedgwick.
Thank you, Bill. Good morning. Thank you for joining the LAEDC for today's installment of our ongoing series on the economic implications of COVID-19. I hope you and your families are continuing to stay well, stay safe, and to social distance during this delicate recovery period. On today's webinar, we're going to briefly touch on some of the impacts COVID-19 has had on households and look at a few industry snapshots to see how certain key industries are progressing during the recovery process. Over the last few weeks, businesses and public spaces have reopened, and many people have had increased contact with non-household members, which increases the number of opportunities for transmission of COVID-19. The Los Angeles County Department of Public Health has reported, as Bill said, a significant increase in COVID-19 cases, in hospitalizations, and in the positivity rate for testing over the last several weeks. To date, the number of identified positive cases of COVID-19 across LA County is moving towards 98,000. Over the weekend, the number of deaths related to COVID-19 moved past 3,300. Los Angeles County not only has the highest number of coronavirus cases among California's 58 counties, but Johns Hopkins University just reported on Thursday that it now has the highest number of coronavirus cases of any county in the nation. The source control order issued on June 19th by the county's Department of Public Health, requiring all persons to wear a cloth face covering both their nose and their mouth in public and in businesses where they may come into contact with others outside of their household, is still in effect, but a new order has been issued. Yesterday, Governor Gavin Newsom issued an order to close bars in LA County, and the county heeded the order, mandating closure unless they are offering sit-down dine-in meals. Weekend visits to nightlife spots like bars, breweries, wineries, lounges, and dive bars pre-COVID-19 were around 700,000. On June 20th, the weekend after these businesses were permitted to reopen following infection control directives, the estimated number of visits reached over 500,000. If cases continue to rise significantly, it could put the reopening process at risk of being put on hold or even rolling them back and reinstating restrictions on certain types of activity. While the economy has been reopening and some workers have returned to their jobs, some LA County residents are still, in fact, losing their jobs. According to the latest data from the California EDD, over 6.6 million unemployment claims were processed in California since the pandemic began. This includes standard claims as well as those filed through the PUA program. Total unemployment benefits paid to California workers struggling through the pandemic have reached $33.5 billion, almost $11 billion more than the total unemployment benefits issued during the peak of the global financial crisis in 2010. Over 1 in 4 California workers filed for UI benefits since the start of the COVID-19 crisis in mid-March. The secondary economic effects of the measures taken to mitigate the spread of the virus has resulted in layoffs becoming more evenly distributed across industries as time goes on. In the beginning of the pandemic, workers with a high school education or less accounted for the largest shares of initial UI claims filed. However, their share declined across March and April, while the share of UI claims filed by workers with higher levels of educational attainment has slowly been increasing since its lowest point in late March. From May 10th to May 30th, an additional 200,000 UI claims have been filed in LA County, bringing the total since mid-March to close to 1.4 million. Healthcare and social assistance, accommodation and food services, and retail trade have the largest shares of UI claims filed. Overall, the number of claims represent 26.8% of the county's labor force. Earlier this month, I shared the Small Business Pulse Survey, a new survey from the Census Bureau intended to measure the effect on small businesses of COVID-19. In addition to that survey, the U.S. Census Bureau designed the Household Pulse Survey to provide vital insights into how the COVID-19 pandemic is impacting households across the country from a social and economic perspective. The survey data provides insight on how education, employment, food sufficiency and security, health, and housing have been affected by the ongoing crisis. Today, I'll be sharing some select data for the Los Angeles MSA, what we refer to as the LA Basin. For the week of June 11th to June 16th, over 5.5 million households in the LA Basin reported food insecurity. Close to 68% of households who reported food insecurity had enough food, but not the types they wanted. 26% reported they sometimes did not have enough to eat, and almost 3% of households reporting food insecurity definitely did not have enough to eat. Households with a member age 18 and over who experienced loss of employment income over the period are facing significant challenges, financially and with their mental health. Over 10% of respondents with the loss of employment income did not pay their rent or mortgage last month, and over 8% have no confidence to pay next month. Over 18% are uninsured, and significant shares of respondents with the loss of employment income are experiencing depression and anxiety nearly every day. The Household Pulse Survey provides data on how households who receive or plan to receive a stimulus payment intend to spend it. Almost 67% will use the funds for expenses. Households who will use the funds to pay down debt and those who plan to add it to savings account for approximately 8% each. Just over 17% will not be receiving a stimulus payment. Now let's switch our focus to some key industries, taking a look at what the most recent data tells us about how they may be recovering. In the latest local area unemployment situation released, covering the month of May, we saw employment levels are still significantly below those in the same month last year. But when we compared payroll employment across the various industry sectors to the month prior, in April, we see that employment has turned positive in some industries, including manufacturing, leisure and hospitality, which includes food services, and trade, transportation, and utilities, which includes retail trade. Let's take a closer look at some of these industries. Retail trade is still down year over year, but the drop in sales related to COVID-19 is starting to turn. In April, retail sales were down by more than 17% from the previous year, while in May, sales were only down by 6% year over year. E-commerce is still showing tremendous growth, with May's sales close to 31% higher than last year. With non-essential retail reopening, we expect year-over-year declines to become less steep in the coming months. The food services industry was one of the worst hit during the pandemic. Though restaurants have been allowed to reopen in Los Angeles County with new guidelines for doing business, restaurant bookings in LA are still 85% below what they were in the previous year. This industry is being impacted by a change in consumer behavior related to the pandemic. As long as there's fear of contracting the virus, a significant number of consumers will refrain from putting themselves in situations where they perceive the risk of infection to be greater. Accommodation is another industry being impacted by changes in consumer behavior. Again, fear of contracting the novel coronavirus is resulting in many choosing not to travel. Occupancy rates are gradually climbing, but are considerably lower than those last year. The red represents hotel occupancy rates in LA County over the same period in 2019. June, being the first month of summer, usually averages occupancy rates of above 80%, while this year occupancy rates are averaging about half that. LA's draw as a destination for tourists from across the globe meant that this industry started to feel the impact of the global health crisis earlier than other industries here. Hotels started losing guests the last week of February, well before the stay-at-home order issued by Gavin Newsom on March 19th, and the safer-at-home order adopted by LA County on the 22nd. Moving forward, the speed in which this industry recovers is dependent upon the public feeling secure enough to resume their travels. International tourism took a hit starting in February as well due to the global spread of COVID-19. However, stay-at-home orders and travel restrictions led total passenger traffic to come to a near halt in April. Though passenger traffic through LAX is still extremely low in May, domestic passenger traffic more than doubled the number of passengers in April as restrictions have been lifting. The number of TEUs moved at the Port of Los Angeles in May were down by close to 30% compared to last year's record-setting May. 5 months into 2020, overall cargo volumes have decreased 18.6% compared to 2019. Softer trade volumes are attributed to canceled sailings due to COVID-19 and the trade war, along with shifts in liner services. The Port of Long Beach saw their trade volumes increase in May compared to last year, with the number of TEUs up by 9.5%. Looking ahead, trade volumes are expected to increase as the economy gets stronger throughout recovery. Going forward in future webinars, we will continue to share the progress of certain key industries during the recovery process as data becomes available. Next, Bill and I will be answering questions.
Excellent. Thank you so much, Shannon, for another great presentation. So we do have a couple of questions. One question that did come into us: what do you see happening in manufacturing?
At this time, we don't definitively know how COVID-19 is going to impact the industry or for how long, but we can speculate what might occur. Some manufacturing industries may experience faster growth than previously expected. For example, biomedical manufacturing may grow at a faster rate than we originally forecast as companies work on a vaccine or produce PPE that is in short supply. Our reliance on global supply chains left us vulnerable when they were disrupted. So going forward, this may lead to more onshoring as a way to increase local supply chains. In the meantime, global supply chain, it will take time to resume. And again, consumer behavior may change and impact consumption and therefore growth in manufacturing. For example, households may increase their rate of savings and reduce their level of consumption as a result of this shock in order to prevent them from being so vulnerable in the future if something else does occur.
Excellent. Thank you, Shannon. One that came in, Shannon, for some of the data that you shared. Do you know how large the population surveyed is for impact, and was it a strong number?
With the household survey?
Yes.
Oh, offhand, I don't know, but I can definitely look that up and reply after the webinar.
Wonderful. That would be excellent. I'd be curious as well.
Mm-hmm.
We have several questions coming in about the healthcare industry. One question we have is, what occupations, or do we know what occupations are decreasing in the health sector? And on the alternative, do we know what occupations are increasing in that sector?
Well, over the course of the stay-at-home order, of course, you had ambulatory and outpatient services that were closed and not doing the typical level of activity that they were normally doing. So you do have a lot of people that have been laid off or furloughed while that took place. Again, because there's such close proximity when you get to healthcare from service providers, you might have, again, changes in consumer behavior where people might be putting off receiving healthcare services until they feel like it's safe for them to do so. So that might impact employment going forward. You might see some declines. It still remains to be seen how our hospitals are going to be impacted in the long term from COVID. And I say that because now we're experiencing, an increase, a spike in cases and an increase in hospitalizations. You don't know what kind of strain that eventually they'll feel in the long term. So that's kind of a question mark in how they'll respond if they're going to have to cut or employment or furlough some workers as a result of their budgets being put under pressure, as they're not getting additional revenue from other services that they normally would because they're having to keep beds that are open for COVID-19 patients. So it's an industry that has a lot of question marks because it's one that's really on the front line of what's happening with this pandemic. Of course, you're going to see solid growth and people who are actually providing services. So your nurses, your respiratory therapists, anybody who's providing those services, they're going to have consistent growth. Where you might see some declines might be in office staff. They might look for ways to outsource some of their accounting or other kind of back office operations.
Also in dental care, vision care, a lot of other related areas were closed, and unless there was emergency dental services required, most dentist offices, dental hygienists were among the healthcare workers that were unemployed during the shutdown period and are coming back slowly.
Yeah. And this next question, I think this could be directed to both of you. Bill, I'd love to hear your thoughts though. The question is, curious to hear your thoughts on the possibility of businesses closing again due to the rise in COVID cases.
Well, I mean, we've seen it already with the shutdown order of bars. Bars are all going to be closed unless they serve food. And so that's pretty significant closure of an important sector that has employed a very large number of people, and particularly low-income people of color, women, young adults, all of whom were disproportionately affected during the shutdown. Or some businesses are choosing to close again. There was a story in the news over the weekend about Hugo's Tacos. Their staff just grew too frustrated with asking their customers to wear a mask. One customer apparently threw their drink on one of the employees of Hugo's Tacos, and the management just said, that's it, we're going to close down for a week until people calm down a little bit. And so some businesses may do that because their workers don't feel safe. Some businesses may do that because consumers don't yet feel safe back in that environment. If those happen in small numbers, we can probably survive that. But as I started this webinar by saying, if we don't show some discipline and responsibility, we could see wholesale sectors close down again, and that would be devastating to the economy.
Yeah, absolutely. I'm going to try to squeeze in 2 more questions because I think both of them have some good significance here. Shannon, this one is for you. Will this economic decline related to COVID-19 be considered a recession? And if so, as we recover and overcome COVID-19, would our economy be in the growth phase?
That's a tough one. So we were in a recession, right? So it's consecutive negative growth, right, for GDP. So we've already experienced that. We're going to be in a phase of recovery. Technically, it's an expansionary period, but if you're comparing it to a pre-COVID baseline, then it's going to be we'll be expanding to reach the level of what we were before the shock occurred. So I guess it's the semantics of it. And then what was the second part of the question, Shane?
Would our economy be in the growth phase as we recover?
Yeah, we'll be expanding. But again, we experienced a huge economic shock. And so that is really, we really need to recover to those pre-COVID levels in order to be back at full unemployment. So.
Yeah, absolutely. And I know we're just about at time, but I do want to ask this last question. Bill, I think this may be directed a little more towards you. Mm-hmm. What lessons have we learned from this pandemic for how we should plan for any future similar situations? And are we developing a master response plan?
So clearly the world was unprepared for a pandemic of this scope and scale. Government was unprepared, our business community, we as individuals were unprepared. That tends to happen when the last major one that the history books talk about a lot was in 1918 with the Spanish flu. But it hasn't been 100 years since we had a pandemic. I was born in 1957 to age myself during a major flu pandemic. In which I believe more than 100,000 lives were lost in this country. We need to be better prepared. That means not only does our healthcare system have to be better prepared, that means we as individuals and as a society have to be better prepared. We've got to get broadband access into all of our communities. Those communities, those businesses in those communities, those individuals in communities who had broadband access were better able to work remotely or operate their businesses remotely or connect with their consumers digitally. It's one of many things that we all have to do. There are education elements, there are investment elements, there are government policy elements, there are ways we do business elements for those of us in the private sector that have to change. And I know we at the LAEDC have done a lot of work a couple of years ago on business continuity and resiliency in anticipation of a great earthquake, not in anticipation of a pandemic, that left our organization relatively resilient in the face of this pandemic. But there's a lot that has to be done. I see one other quick question from our friend Robert Sines about the economic implications of the CARES Act, extended unemployment not being extended. Those would be significant. I think it's relatively clear that it has helped people through this pandemic, those who have received. I was distressed to see the number Shannon shared, that 17%, I believe, was the number of people in our community, according to the Pulse survey, have not received stimulus payments. It is going to be critically important that these be continued if the economy is not able to fully reopen. And at the pace we're opening, it is entirely possible we will not be fully reopened by the end of July. Certainly segments relating to around theaters and amusement parks and sporting events and others will not have reopened. So some continued unemployment assistance and small business assistance is probably going to be required. I want to say one last thing, knowing we're a moment over, that's important. The US Census for 2020, 61.8% of Americans have responded. 62.9% of Californians have responded. Only 57.9% of LA County residents have responded. Only about 51% of LA City residents have responded, and in some lower income communities, communities that have historically been slow to respond to the census for a variety of reasons, which may include lack of broadband access to respond online, which is how most people have been responding at this point, it is less than 20% have responded. We, again, as leaders on this call, must do everything in our power to use every network that we have, every voice that we have, amplify every voice that we hear to get everyone in our community to respond to the census. It is important to our political representation in Washington. It is far more important to the allocation of resources, which will be more desperately needed in our region over the next decade than ever before. So please, everybody, get out, do it yourself, get all of your friends, family, and colleagues to do it. Let's ensure a far greater participation rate in the US Census than we've shown so far in Los Angeles.
Absolutely. And thank you both, Bill and Shannon, again for joining us today. And as always, for sharing your thoughts. Before we close out today, I do want to share that we do have a new webinar that we are going to be hosting tomorrow. And this webinar is going to be focused on strategies for reopening your business. And so, and I'm trying to do it now. Apologies for my multitasking. So we should have, if I can get it up there, a link in your, in the chat feature that we are sending right now to everyone. So that way you can get registered. It's going to be tomorrow at 11 a.m. We're going to be joined by our partners at AECOM, ServiceCon Systems, as well as Nixon Peabody to discuss. We'd also like to share with everyone that moving forward, these weekly briefings, we are now going to turn into a slightly different and new webinar format occurring once a month. And these will occur on the Monday following the third Friday of each month. And if you're wondering why it's that specific, it's so it does coincide with some of the new unemployment data that is released. And so that means that our next webinar, Monday webinar, will be on Monday, July 20th at 11 a.m. And we will, of course, share that registration link with you. To all of our attendees, please email any additional questions you do have to shane.cullen@laedc.org. That email address can be found on your screen. And then as always, we do encourage you to visit the LAEDC's COVID-19 response page at laedc.org/coronavirus. Thank you everybody once again for joining us, and we do hope you all have a wonderful week and enjoy your holiday weekend.
Thanks, everybody. Take care, be safe, wear your masks.